now that we've been so successful with having this tri-county model in relationship to communicable disease response, it would be really challenging to go backwards. And this has made a huge difference for, I think, all 3 counties to be able to feel like they're doing a great job around communicable disease response. So to me, it's critical that this kind of program continues.
As new as this Central Oregon Public Health Partnership is, I'm surprised on how tight the group already actually is and how well we're working together. The benefits have really shown and the value has really shown. We as a region understand that we are, yes, we're 3 counties, but we are one Central Oregon region.
We really looked at the data and looked at what is our need in this area. And it was kind of that threefold of prevention, surveillance, and response. We have an older population here in Central Oregon, and within long-term care facilities, that's who's seen the majority of the flu outbreaks and the noro outbreaks that have really a detrimental effect on these residents.
We have a very fragile population with the elderly. A lot of them have multiple disease states that could impact their, getting something as, common as the cold or something, and if that turns into something else.
A lot of the reporting and data that we're doing is now sort of a regional view. So for example, the Central Oregon Weekly Flu Report, last year it was just Deschutes County view, but this year we're kind of expanding it, which I think has been really helpful for providers and for the media, because a lot of those people and a lot of the media outlets work regionally as well. And I think the other thing that I'm able to do now that I wasn't able to do before is I can really focus in specifically on communicable disease. So I have more capacity and more time to be looking at the data more frequently and kind of paying daily attention to what's going on in the region.
At the Oregon Public Health Association meeting, Dr. Jenny Faith introduced herself as the epidemiologist for Deschutes, Crook, and Jefferson County, which I thought was just phenomenal, because we don't really have on staff an epidemiologist that can give us that data, that real-time data, instead of the end of the year report that we typically see.
With my background in infection prevention and bringing that to each of these facilities, it really runs the gamut. We talk a lot about multi-drug resistant organisms, isolation, how they can, a lot of it around that preventing transmission from resident to resident to themselves, hand hygiene of course being key. Some of the facilities have specifically said, could you please come and tour it? Give us ideas on what we could improve better.
And she graciously came out and did a day-long seminar on infection prevention, communicable disease, and gave us all sorts of resource books like this one here. If we have an outbreak of the flu or something like that, we can give them a call. They'll actually send a team out here and help us to contain it, help us to prevent the spread of it and manage it. I want them to come back, at least every couple of months, give us an update on where we're at with infection prevention and disease spread.
This opportunity has given us the ability to do more prevention in the community and really reach out to those partners. It's just kind of raising the level for everyone in relationship to understanding about communicable disease, preventing outbreaks, and who you can call for help. It's been really successful. It gives each county their own voice, and at the same time we're doing tri-county work that's improving health and making sure people don't get sick in this region.